because we had her doing house calls on some days, which isn't always ideal, but the way it worked out in our situation is something that we had to do.
Michelle and everybody
I think we landed about like 20-25%
below that.
Yeah, for below the line.
You guys talk about the HIPAA laws?
Sorry, Sonia and I are apart but together.
Damon's trying to ask a question.
So I think
Michelle, can you and maybe some of the others talk about the HIPAA laws and who? Okay, so obviously you have a test. Give me 1 second, Michelle. You have a test, and that information, a lab gets that information. Who is it shared with? Who is it not shared with? And who do you recommend it being shared with, as opposed to what happened on your project? And maybe, Michelle, you could briefly do that, and the others could chime in.
So on our show, so the HIPAA test, the HIPAA consent forms were signed by each crew member, obviously before testing. The information was shared to one person, which was me, on the show. I then had to communicate yes or no. It was also shared by the testing company to the individual at the same time.
Other experiences?
Pardon?
Did anyone else in the group have experiences with?
Jamie, Francis can speak to that because that became a point of concern for the IA.
What we did was we had the health and safety officer was the doctor, so the lab would send the doctor the results, and we had hired him a secretary and we had done an approved to work form and like a certificate for each crew member. So the doctor would send it to each crew member, and they had to present that at every entry point every day, and it had a date when it was valid only until the day they had to retest. And that is something to really discuss, because although it is private information, producers need to know, and the health and safety team needs to know, who's not approved so we can do proper tracing. And that was a topic we had been in discussion with the union. I think it's a fine line. I mean, the employer needs to have the right to be able to mitigate when somebody is positive. So in our case, we just created these forms, a certificate, so it would go directly from the doctor to the employee, and then they had to present that at entry point to be able to come to work every day. I believe now there's an app available, which is even better. A friend producer is using in Atlanta. So I think the challenge for us was implementing these protocols, which were for everybody was very new. Every day in a new location, and some days we had 2 locations, and then how to deal with changes. We had a location that they had it was like a farmer's market, and we had a positive case of one of the employees of the farmer markets, and we just had to pull and change our schedule for the next day. And well, that brought other problems because we weren't ready, and we didn't have testing results for the special effects. We had a huge rain rig for that day, and we had to advance that day. So, and the union didn't want to allow us to use a rapid test, but that day we had to use rapid test, and sure enough, as soon as we got the positive and started working, we got the results from the molecular test. But I think in general, it's not having the flexibility to change as things are, as fast as productions need to change. It's one of the challenges that we faced. So, and just thinking out of the box as well. One day we had to move people. Nobody wanted to get in a transpo van. So I said, let our AD suggest, let's rent school bus. So we just got school buses with the windows down, and we moved people that way. So it was fun.
A broad question, in terms of dealing with the unions and the guilds and getting their clearances. Can anybody speak to kind of this maybe specific challenges of that, the timeline that it takes to do it, you know, now that you've been through the process? Anybody want to take that?
I mean, one thing that SAG wanted to get, you know, what locations, you know, in advance are we shooting? And, you know, when you're doing a, you know, a film that's, you know, $4 million, there's lots of question marks at the end of the schedule. Things aren't scouted yet. Things aren't contracted yet. So we had flagged a lot of work for SAG to be on the stage. And then with the caveat that we may pull some on-location work, you know, out of that plan. So, that was tough just to kind of get around. And they changed their protocol for testing from when we started to prep to when we had our production call. But, you know, we worked it out with them once they got a number of people on the phone to talk about it. And we did have an epidemiologist as our safety officer, which was helpful, especially with the SAG expert. They had an epidemiologist on it.
Can I get internet? Why can't I get
that was very helpful.
sounds?
Yeah.
Yeah, we had, I mean, our experience here in LA was, you know, the IA was actually we didn't have any trouble with the IA or with the Teamsters really, or even frankly with the DGA. The DGA was, you know, I mean, we felt like we had a pretty robust program. We had an extensive testing protocol, et cetera, et cetera. The DGA just sort of said, yes, okay, we'll be fine you know, waiting for SAG to sign off. SAG was really a bummer. I mean, it went to the 11.5 hour, you know, and it was at one point that, you know, we were in the middle of negotiating and talking to them. And then suddenly I read in the trades that they put a do not work order on us. And then an hour later they rescinded it without it. I only found both of these things out in the trades. No one ever told me personally. So that was really unpleasant. But it at the end of the day, you know, we kind of came to an agreement that seemed to satisfy everyone. But that is certainly a piece of advice that I would recommend to everybody, is start that process early. You know, start the union discussions early. Because there is, and you're right, you know, the protocols change all the time. You know, they're different now than they were 2 months ago, and they'll probably be different in another few weeks. You know, they're hopefully going to come to some industry-wide agreement soon. But in the meantime, it's just case by case, and you got to kind of just tackle it. So yeah, start that early. Start testing early. That's the the earlier you start your program, all of it, whether it's unions or your own personal testing things, the sooner you'll reveal the flaws in it and be able to head them off.
I have a question. Did anyone use Hall Pass for the health and wellness questionnaires?
No, I don't know what that is. Was that an app or a?
It's an app.
Mm-hmm.
Yeah, Hall Pass does. They actually provide. It's an app, and they provide you also with QR codes that everybody at Zone A, Zone B, whenever you pass through a zone, if you pass through a zone, if you're one of those co-zone people, or cross-pod ops, as I call them. It tracks their movement. So it also helps you understand who needs to be tested more often, because it does like kind of a data analysis. It also allows you to have your employees check in early before work, before they come to work. So could be a time saver. And it also helps you track and record testing results, I believe. Unfortunately, it was small, it was 2 days. So we talked to them extensively, but decided that for budgetary reasons, it probably wouldn't be a good idea for us at this time, but I'd love to try them again on a longer shoot, because I think it would put everything in a central place. And then it also gives the employees the ability, you know, they have to remember to check in, they do it on their phones, they do all of that, but it might be a time saver, and it might be worthwhile to see how, you know, track your movement and see actually some people they find are moving more than they think.
Is it I know I've heard a lot of people express a lot of concern about, because I know there's a number of these kinds of things. You can get a system, I know, that with wristbands, and you can track people's proximity to other wristbands, so you can understand who was a close contact or whatever. We didn't try that. We didn't get in any discussions, but I would anticipate an enormous amount of pushback from the unions with anything that would be tracking people's movements.
The unions have pushed back on those systems. I'm curious, has anybody had experience? Did you pay crew to, because I'm hearing now also that unions are asking to pay crew as soon as they download the app to start checking themselves, as well as, did you pay people to quarantine? Did you pay people were required by anybody to do these things? Or did you just do it? Anybody, did you pay for testing, pay for quarantine, We
paid for testing. We paid for, and that, I know that the unions are really standing hard on that, is that they're considering testing time to be work time for a number of reasons. Because first of all, obviously, if somebody's asking, if you're asking them to report somewhere and take a test, then they want to, they want to make sure that that's covered. Second of all, I think it provides them, if the test in time is considered work time, it provides them some protection in terms of sick pay, both from the federal law and from whatever your company sick pay policy is. So yeah, we paid people. In our case, it was a 4-hour day for each time they were required to report for a test on a day that they weren't otherwise working. I have heard that lately that the IA has been trying to expand that to an 8-hour call for each of those days.
Yeah, we had to pay an 8-hour day for the testing.
And I think they're also demanding I don't know that necessarily, I haven't heard them demanding to be paid beginning when you download an app, but I have heard them insisting on cell phone allowances if you are required to use an app that is cell phone based.
Yeah.
Once you start inputting into the app, they're asking to be paid. Once they start tracking you, once you start filling out the app with those couple questions, they're asking to be paid.
I'll tell you, in our case, in the protocol we designed, we had added self-quarantine just to mitigate the risk. And that was we didn't win that battle with the union, because if we wanted them to self-quarantine, we would have to pay them to be sleeping at home. So if you're going to quarantine, they're probably going to want you to good luck with that.
Right.
We have a lot of questions piling up. A lot of them, and I know we touched on it, have to do with protocols of people testing positive, false positives, but also people testing inside Zone A. And if that means, how does that happen if someone's actively on Zone A when you get the results? And also, does that mean you have to shut down your entire shoot for the day and test everybody? Did anybody experience something like that?
Well, I can actually talk to that. I had a 3:30 call today on set, and so I stayed in the office here to have this call, and somebody showed up and said that they had symptoms, and so that triggered all of our protocols to happen. So live and direct here, I'm traveling to set in a rush to deal with this, and so what happened was this person has now been sent to go get tested, and then we talked to her to see, she's living in a house that we rented with a few other crew members. So we've told those other crew members, and now everybody's been sent to get tested. And now it's a matter of going around and reassuring people that nobody's tested positive, simply one person was showing symptoms. Now everybody's continuing to work until we get the results back, hopefully tomorrow morning. And those people would be allowed back to work, and we're continuing to pay them for the day and putting them up, making sure everybody gets back to that house that we've rented for them in quarantining until we get the results back.
how are you substituting for them? People just stepping up into the next, or?
Exactly. And so now everybody's just went around and everybody is stepping up to do that. And now obviously there will be, I'm going now to deal with bump pays and all this stuff and how all that's working. But every department now is going to be, every department that was affected by this is going to be shorthanded, and people are stepping up to take that other role. More importantly, I had a call. I stepped off for a few minutes to talk to our lead actress that wasn't comfortable going to set, and so I had to explain to her our protocols that she potentially didn't remember at length during our pre-production meetings, and now she feels comfortable, so she is going to set to work, and she'll be tested first thing tomorrow morning, in addition to everything else that we're doing.
Good God, this is incredibly dramatic.
Yeah. I thought, anyways, I've been listening. I went from my computer to my cell phone and then was going and regretted not having put gas in my tank yesterday. And so I had to stop for gas and now rushing to set. And so there you go, live and direct from COVID in Northern Ontario.
The people that you polled that have the symptoms, you'll get the test results back?
We're hoping to get it back within 24 hours, and that's what we've been able to do with the local lab here.
So those people will probably be offset for tomorrow, and you'll just continue with this bump up until you hopefully can have everybody.
Correct, because we can't bring in dailies or anybody because everybody needs to be tested anyways, and so it's sort of that if somebody obviously comes, then everybody gets tested. Everybody gets quarantined, and then we do an analysis of who and what we do at that point.
Has anybody had a DP or sound mixer have a positive? Or
No. And so today, what happened was it was actually one of the COVID teams that came that's staying at the house with this other person, and so it was her, my dolly grip, and a grip. And
Jason, we're losing you.
Sounds like
actually, to Bob's point, in Linda's show, we had a false positive within AC.
Fantastic. And so how did you deal with that? The AC is, so I'm not in a position where somebody isn't able to be replaced here or step up. But yeah, how did you deal with the first AC testing?
Linda, do you wanna speak to that?
So the first AC, so one of the challenges, which I haven't figured out how to solve yet, but once people test negative a few times, and on our show being on an island, which has a quarantine-like environment, they started to feel like that was a hall pass to not social distance. And so the first AC and the DOP had interaction, and the DOP and the director had interaction. So all of a sudden, we were immediately making plans for if everyone was positive, because you have to do that simultaneously to trying to figure out how to get people tested as fast as humanly possible. Obviously, if it's the director, the show goes down. We have a second unit, and we were just going to bring the first AC from second up to Maine, and the less experienced DOP from second up to Maine. But while we were also getting avails on people that could replace them for Maine. This is a 22-day shoot, so it could take you on an island with air travel. It could take you a week to solve a problem, and you only have 1 week left for us of photography. But every time we have a false positive, it's an emergency response, trying to figure out all of the ways that you'll pivot depending on what the real results are.
Well, and that was one of our questions with it too, is what do we do when cast members, directors choose to ignore the protocols? What did you guys do?
Well, we had a talk with our line producer on the ground there about using this as an example of how you can't get complacent and why you can't assume that you're negative test, and nobody's living with They're not going home to other households. Everybody's isolated in an apartment. They felt like they were safer than they theoretically are. And that's exactly the kind of thing that can put a film in jeopardy. And that harkens back to the need for an epidemiologist, because a big part of what epidemiologists do is change human behavior. And they figure out how to convince people, message, it's a public health job too, how to convince people that you have to change your behavior to be safe. And that means that you can't have the social experiences that you would normally expect to have when you're on a crew, whether they're, it's a working dinner or a social dinner on a weekend or walking to a market. People still need to stay completely isolated even while they're testing negative. All that being said, I don't know anybody that thinks that a full crew will do that no matter where you are. So you have to anticipate.
I'd like to.
Risk everywhere.
We were. I mean, I just want to remind you what April was like in the, worldwide. And I was shooting in an Islamic country, in a small town where every hotel, we were all moved into one hotel, and the hotel knew exactly who all the Tinder prostitutes were, and our crew kept calling them. I mean, it was insanity. It's like we're in the middle of a global pandemic, and you're calling prostitutes to the hotel, and the hotel's reporting it. So, it was. I think it was a much more stressful time than it is right now in terms of fear of the disease. But don't underestimate the idiocy that might occur.
No, I mean, I agree completely with Linda about the complacency issue too, that's something that we definitely, over the course of a 3-week shoot for us, the first week is everybody getting over their anxiety, and the second week is kind of, okay, things are moving pretty smoothly now because everybody's got the hang of it, and they've gotten accustomed to wearing their mask for 10 hours, 12 hours a day. By the time you get to the third week, people are getting too comfortable now, because you're right, they've been testing negative, they've been doing, you feel like you're in a bubble, but you're not in a bubble. And so we had the benefit of having, a crew with which we had, in some cases, a lot of experience with, a long experience, and it was a mature crew, not a lot of craziness. But still, that's the thing, you worry about what people are doing at home. We would send an email every Friday with a sort of a risk assessment chart that we had received from our epidemiological consultant. And we would just hammer it every Friday, like, please, on the weekend, be mindful of what you're doing, because whatever you're doing on the weekend, you're bringing into work on Monday. And that's the only way we're going to finish is to maintain these protocols. Because at the end of the day, the testing doesn't, the testing can hopefully, if you've got a good, robust testing program, you can arrest an infection before it goes rifling through the entire crew. But, it doesn't, you can't, the testing itself won't prevent it from happening. The thing that will prevent it from happening is people complying with all of the other stuff, the distance and the masks and the hygiene and the vigilance in their personal lives,
And during the training, that's something that we really tried to emphasize a lot, was the culture of vigilance, in terms of all of the things that needed to happen in this kind of safety net that you're creating, with distancing, masks, hygiene, that without the culture of vigilance from the crew, it's all moot. We can all put in the most stringent protocols that we can think of, but if people go out and act irresponsibly on the weekends, then it sort of goes out the window. And I do feel like one great advantage we had was we had a very, very responsible crew and people that were very invested in trying to get back to work. It was obviously really important to them. And, we really tried to hammer that home in all the safety trainings, just over and over, that we respectfully ask that even on the weekends, that people still practice everything that they're learning in the training.
Well, and that it isn't about your own personal risk it's about community risk, you know, and so it's one of those things to just hammer into people that it's like, okay, you know, you may be willing to take the risk yourself, like, oh, it's no big deal, it's just like the flu or whatever. But it's, you know, if you are behaving that way, really you're putting all of your friends, all of your coworkers, the project itself at risk of not being able to finish.
And I'm quoting the epidemiologist that we're working with. Her name's Dr. Anne Ramoyne, but she did say, but look how hard it is to get people to change their behavior. You know, texting and driving kills people, and it still happens. People wear seatbelts now because we literally had to install them in cars. If you're old enough, you remember being completely jerked back in your seat by the automatic seatbelt. If that had never happened in human history, people would still be driving around just like they are with texting now, choosing to do both at the same time. Unless you're forced to do it, physically restrain people with a seatbelt in your car, culture didn't change. And this is a similar thing. So you won't have a risk-free set no matter what. But trying to instill a public health message with somebody that's in a position of authority to do it. And I think then also from the leadership on the show. So in my case, the director telling his department heads, I'm not going to sit down at the table and have dinner with you. Like, that also sends a message all the way as far as you can go, and you can't get all the way.
A number of people, obviously we've gone longer than originally scheduled, need to drop off obviously because of other commitments. If people are willing to stick around, we can obviously keep, there's probably a billion things that we haven't touched on, not that we're going to do that, but obviously we understand if people need to drop off. There's a few questions in here. I don't know how well people will be able to answer them. One is just about the difference of shooting internationally versus in the States. Basically, if the protocols, I guess, are a little bit more lax outside of the country. Obviously, there's different parts of the world, but I guess we can speak specifically to Canada since we have a few Canadians, or maybe we've lost them. But, I know obviously there was the issues that were well publicized in BC about testing requirements. Moira or Jason, I don't know or Kate, if you want to speak to maybe any stark differences between US and Canadian protocols. Everyone's on mute.
Well, the biggest thing is that the federal government in Canada hasn't stepped in to backstop any kind of insurance. And so any productions happening right now in Canada do have an exclusion for communicable diseases. So that's one big thing, I guess, regarding the productions right now in Canada. But else than quarantining people traveling from abroad, we haven't had any issues with immigration and getting people in, else than the additional cost of traveling them private. And then regarding the daily protocols, it's I don't think anything out of the extraordinary than what we're seeing in the States.
There was another question.
And sorry, go.
No, go ahead.
Well, I just pulled up the set, and so needing to deal with the 911 situation that I'm in. And so I do bid you all farewell and best of luck, and look forward to, if there's another one of these meetings, participating and giving everybody an update to the associated to what just happened today.
Yes, we love to hear it. Thank you so much.
Good luck.
In Canada, though, I don't know if Moira or Kate are listening, but in Canada, can you, the testing for US and SAG is 3 days a week, and I keep hearing a couple productions that are shooting in Canada having issues with the Canadians not wanting that amount of testing, and having to do also with the public health there versus us bringing in private doctors. Are you guys there? Or do you know anything about that? Are they gone? Yeah, I've heard a couple of times overseas the rigors, so to speak, of the U.S. protocol is getting pushback. So I was curious, anybody overseas had worked or done that? Maybe not on this call.
Well, kind of a reverse of that, there's a question in the chat about, has anyone had to bring foreign citizens to the U.S.? you know, and challenges of getting people into the country. Bob, maybe I think you guys maybe have had to deal with that specifically.
We did. We had two. Well, we had 3 cast members that had been previously established that were in the UK that we had to get in. One of them was a US, had a passport, U.S. passport, so that was not an issue. But the other 2 did not. They were UK nationals and we had visas. We had obtained visas for them, but you know, still the travel ban was in force. So we did end up flying them privately from London to Los Angeles, and we managed to get an you know, it was like some voodoo magic that my aircraft guy performed, but got them. We managed to get them declared essential personnel, and were able to get them in, which was obviously a great relief to everyone. So, but it was a little hair raising.
Did they have to quarantine when they got here?
No, because there's no quarantine rule in Los Angeles. You know, if they had gone to New York or someplace, then they would have. But in Los Angeles, no, there's not. So we had our own quarantine protocol based on the recommendation of our infectious disease guy, who he recommended. So I mean, we had them tested prior to their departure in the UK. So we had them tested there. They, within like whatever 48 to 72 hours of the flight, they got on the flight, came here. We had them self-isolate here in the US for 4 days, and then tested them again twice before they were permitted to come to the studio. 4 days, 4 days, because our medical consultant, you know, said this is the sort of average time of incubation between exposure and detectability is.
Bob, who is your immigration lawyer?
Our immigration lawyer is a woman named Dora Kimura, who's great, by the way. She's the one that procured the visas. She's not the one that did the exemption for us, although I think that she has had also some luck getting this type of exemption before. I did kind of consult with her a little bit, but in our specific case, it was the private charter broker that handled it.
The exemption to
yes.
be an essential worker?
Yes. He bird dogged it through CPB and got the ultimate sign off. But I think Dora has also had to tackle this problem in a couple different cases.
Well, so I'm getting a lot of messages of people who need to run shortly, and obviously we really appreciate everyone's time that you guys have given, and I know there'll be follow-up conversations to this. I guess just as kind of a final word, if anybody wants to have one, you know, the whole idea was to sort of glean wisdom from what you guys have dealt with on your shows going forward. So, you know, either repeat a point that maybe was already made or something that we've missed, just a kind of a key piece of advice for those who haven't been in production yet of something to be mindful of as they plan for their shoots going forward. A question I have is about prep time, whether you feel additional prep is necessary, you know, just because of all these new kind of hurdles to get over, but I guess whatever thing you think is most important.
I would say absolutely necessary for this. I mean, there's so many factors to figure out. Thankfully, it's going to be hopefully farmed out to a separate department. However, as it integrates with production, you know, the levels of planning and pre-production, I mean, you have to, we did basically our daily risk assessments, you know, for every single shoot day. We didn't do one for the overall shoot. We did one for every single day. We just found it easier to troubleshoot each and do it day by day. But to be able to do this, we had to have all our locations lined up as far in advance as possible. And a lot of those questions that you usually don't have answers to until closer to principal, you had to have answers to sooner than later. And one of the things that also I gleaned from this was you're not able to pivot as well as you used to, if at all. You know, if you find that you need extra people for the next day to do what you thought you were going to do, you can't have them because they haven't been tested. You know, so you have to make do with the crew that you have. which was a little unfortunate, but it also forces you to think about how to redo the following day's work, you know, rather than as it was planned. So that was an interesting lesson to learn, is that, you know, the fact of adding PAs on the day or the next day, or extra riggers or extra grips or electrics, whatever you're going to need for that day, isn't really something that you can do anymore. Spontaneously, that is.
Sonia, Bob?
Yeah, I mean, I agree with that completely. It's like, it's, you know, I would, you know, I feel like I do feel like it takes a little extra prep. I mean, obviously before, you know, if you were going to have your wardrobe department start on a Monday, ideally the week before that, they have to be undergoing some form of training. They have to, you know, you have to sort of go, there's a, you know, we performed a series of kind of risk assessment meetings, you know, that Karen oversaw along with our safety advisor, safety consultants, you know, with each department in the weeks leading up to their the beginning of work on set, or you know, or in the shop or wherever. And so all of those things take time. It's just to kind of get it all, you know, get the protocols in order, get the safety training in order, find all these people, line it all up to get, you know, and all of that has to happen before the sort of work that we're all accustomed to of producing a movie begins. The whole, yeah, the lack of flexibility is a real thing. It's like, I always, you know, liken it to shooting on an island. So for those of you who've just been shooting on an island, you know what that's like. It's, if you need the, you know, if you need a techno crane, you gotta know that a week ahead of time, because it has to be sent in. And it's the same thing with the testing. I do find in our case, it was helpful, so helpful, because we had rapid testing.
Yes.
You know, we were using, you know, we had 6 Abbott rapid testing machines in a trailer on site, you know, and, you know, doing, you know, and the Abbott is not a perfect test, you know, for everyone who's done all the research about it, but the ability to repeat it frequently is overwhelmingly powerful. I mean, even if the test is, you know, because they're, you know, the sort of widely discussed, you know, statistics for, you know, propensity for the test to produce false negative, it could, you know, be 15 or up to 20% of the time. And that's, of course, alarming on a per test basis. But if you are performing the test 5 days a week on people and getting results in 15 minutes, then you are immediately reducing the chances of receiving repeated false negatives with any one person. So if as soon as you perform the test twice, now the percentage of false negative is down below 4%. If you do it 3 times, it's below 1%. So it's, you know, having the ability to do, so if we had some emergency, if we needed a crew member at the drop of a hat, we could drag them in, send them to the trailer, and give them 3 tests right away in the morning, if that's what we felt like was necessary. And so, and sometimes we did that. We would just double test people in the morning if we absolutely had to pivot, although our preferred method was to sort of spread those tests out 24 hours apart.
Bob, did I hear you correctly that you had 6 Abbott readers?
We did. We had 6 Abbott machines, yes.
Wow. 2 questions that popped up specifically to that. One is the Abbott approved by SAG? The other being, what was the cost per machine per week?
It's not approved by SAG, and that was the source of some of our delay with SAG. At least at the time, you know, I know that this is the method that we were using was, you know, we developed and, you know, was sort of specifically recommended by our infectious disease consultant, who firmly believes that if you are in a situation where your goal is infection control and infection surveillance within a population, that the speed, you know, the repeatability and the speed with which you can get results is more important than the accuracy of each individual test. You know, and especially in a world where you're in a hotspot and you might be waiting for results for 48 hours, you know, or in some cases longer. those, as soon as you're beyond 72 hours, they're not even useful anymore, you know? So you know, by the time 48 hours has gone around, I've tested the person 2 or 3 times already. So no, it was a point of dispute with SAG. And so we ended up in order to appease SAG, we had to agree to layer on another test, a lab-based PCR test. So we were testing for all Zone A. All of our Zone A people were getting 5 Abbotts a week and 3 lab-based PCR tests as well, 8 tests a week. And those we did, obviously to get the sign-off from SAG and to provide them the assurance we need, that they needed. But we never, the only time we had a disagreement between the tests is we did have a false positive once from an Abbott, that then we were able to, we had and a lot of people talked about the protocol. For us, the protocol for a false positive, or in the event of a positive test, we had the same phone tree. Only certain people are permitted to know the specific identity of the person. But for us, the protocol was a little dependent on the type of test. An Abbott test is not considered a definitive diagnosis. It's considered a presumptive positive, and it's subject to confirmation. So when we had a positive from the Abbott, we isolated the person, immediately brought them back in. We brought them back in for additional testing. We tested them again with the Abbott, and in fact twice more with the Abbott, and got 2 negative. Then we took a sample for a lab-based PCR test, and we sent that off. In the meantime, we quarantined the person and their sort of group of close contacts, and sent them home until we received the results from the other test, and they came back negative, and we sent everybody back to work. It's different if you're using a PCR test from a lab. The rules are different per the county, per LA County, and this is certainly a difference, I'm sure, that where the rules within the United States, and specifically within certain cities or counties, are different than they might be in a foreign country or whatnot. In Los Angeles County, if you receive a positive from a lab-based PCR test, that is a diagnosis, and you are required to quarantine for at least 10 days. And all of the close contacts of that person are required to quarantine for 14 days. So, and you can't test out of that. It doesn't matter how many negatives you get. You can't test out of that quarantine. So, in any case, we were fortunate. We never had any false positives from those, or any positives, I should say, from those tests. But I will say, it's regardless, and obviously the calculus with all this might change as different, more accurate rapid testing becomes available, as the turnaround time hopefully gets better at a lot of these labs, or if depending on where you are in the world, what your access to a lab that can provide you with 24-hour turnaround, or less, that's great. For us, I will say that having the access to the rapid testing was incredibly helpful, and I think that the crew felt it was, it went a long way in terms of reassuring the crew in terms that the work environment was safe, and it allowed us to be a lot flexible than we might have been able to be.
And I would also just say that, in terms of talking about what we talked about earlier, the alleviating anxiety of the crew, one of the things that we did that I think really, really helped with that was, once we had established our protocol in the event of a positive, it was very in depth, and we emailed that out to the crew and basically said, just so everybody understands, in the event of a positive, this is exactly what happens, and we will notify you. Of course, we can't disclose who the positive is, but we will let you know if there's a positive case. And I think Bob and I were both really surprised at the response to that. I mean, it really seemed to give people so much assurance. I think they were very worried that we weren't going to be transparent. There might be some agenda to sort of, hide a case. And when we put that out, everybody came up and they were sort of like, wow, that's great. So are you saying that, so there haven't been any cases? And, I would have to run and knock on a piece of wood and say, yes, thus far, that's the case. But I would highly recommend that for everybody. It really was.
Yeah, just the maintaining the transparency, I think that was extremely helpful, I think, for the crew and it's because as I think, Linda was saying that it goes along, it's along the same lines as having a medical advisor who can provide you with, independent risk assessment and medical advice that the crew and everybody sort of perceives to be different than the production agenda. And so it's, and the more transparency you can give people about this whole test result thing, I think the more it makes people comfortable.
And in terms of going back and looking at what I wish we had been able to do differently, again, to Linda's point, one of the things that I would have liked to have had is access to that medical expert, that epidemiologist, earlier than we did. Mm-hmm. And once we had that person, it offered us so much confidence. And I think the crew as well. I mean, as production people, in the void of real answers, you have to make a plan. So Bob and I would find ourselves, we're writing the protocols, and we would go through them and say, is this real? Do we just make this up? Or, is this based on something? So it was so nice to be able to have an infectious disease person read it and say, yes, this actually is right, or you should change this a little bit, walk through all the trailers, make recommendations for all of that, just on the ground stuff. It really made a huge difference.
And that person, in our case, that our person was able to come and visit they visited the set. They were there on the first day of shooting. We made them available to the crew for just a general question and answer session. He would walk around and kind of visit some of the different departments and whatnot. And that also was just, giving that person or giving the crew access to that person was very helpful and reassuring to everyone around.
I have a question about SAG. Were you able to get an answer from Screen Actors Guild as to why it's 72 hours from administration of the test to the cast member, that you can use them instead of 72 hours from results?
Well,
they were sticklers with us about this, and I couldn't wrap my head around it.
They were looking, in our case, they were looking for 3 days a week testing and 24-hour turnaround from the lab is what they wanted. And so, or as close to 24 hours as we could get. And so, and obviously in Los Angeles now, getting 24 hours is difficult. So we paid a premium to our lab to get faster turnaround. I don't know that it's, we got as close to 24 hours as possible, but no, they were, I don't know that they were, we didn't get into the 72-hour thing necessarily with them. I don't recall that being a specific, that wasn't the thing they were hung up on, at least not with us.
That has to do with the gestation of the virus and how long it takes to shed, I believe.
Yeah. Oh, between the time when you're detectable and when you're when it's transmissible.
Yeah, testing and then the results. That's their sticking point.
No, it's true, and yes, that's the sort of, that's the point of that our doctor was making too, is that at a certain point, like once you have waited more than 48 hours for results, you're not putting yourself in a very strong position in terms of being able to control an infection on the set, or trace contacts accurately. So it's, I hope that, obviously we all hope this all just goes away and we have a vaccine so we don't have to deal with this anymore. But certainly in lieu of that, it would be helpful to have more readily available, more accurate, rapid testing, point of care testing, because that is, it's the deal. So.
Francis, any, I guess, last words? I want to give you a shot to impart any final wisdom.
I think COVID, it's uncertainty on if you're going to get it, if we're going to get a vaccine. And I think mitigating the risk on all these other, I mean, testing, having somebody, a manager that can hear out their crew's concern. And of course, there is a responsibility and all the things we need to do, but it's also very personal. I mean, people actually fear. In our case, we were able to have a crew that was well informed, that we worked with every department, that we had a great team, that they felt safe. And I think at the end, that's gonna make a difference in how you end the production. I do think you will find people that go out you know, after work, and you can't control that. So we are responsible for the health of a crew that you don't have 100% control of. So I think it's very personal, you know, it's very personal and very emotional, and we will continue to find ways to make it work, but it is possible. It is a little more costly, and I wish everybody here luck with their next production. Stay safe.
Well, so we do need to wrap it up. I apologize. I know there's questions and comments that we didn't get a chance to address. You know, we can obviously try to answer them separately via email, as obviously we all have contacts with one another, but thank you to everybody for participating. Maybe we'll do something similar a little bit later and get to more specific issues, but thank you all so much for being here. Really appreciate it.
Thank you.
Have me, Steve.
Okay. Take care.